if I'm given a complex problem, I can't throw a simple solution at it and call it a day. My solution needs to be sometimes as complex and in some ways more sophisticated to counter what is lost. And one of the techniques that I've used is a technique called forehead flap. I tell people that if I need a lot of tissue or a complex tissue that I need to reconstruct, I need tissue from somewhere. And the best match is the forehead skin. So if you can imagine the match of the nose tissue in character and you know the contour and the way the light hits it, the forehead is actually a very, very close match, believe it or not. And the old school surgeons back in the day obviously knew about this. I tell people that there's a blood vessel that comes up from here all the way up to the scalp. I take that blood vessel with a finger width of tissue, and while I keep the blood vessel attached at the brow where the blood vessel comes out of the eye socket, as it were, and then goes up towards your scalp, I take a finger width of tissue, and while I keep it attached, I turn it down and I sew it in. And where that finger width of tissue came from, that just closes up, leaving them with a scar on the forehead. Now, I must keep that tissue attached for anywhere between, some people say a week, 2, 3, 4, usually about between 2 to 4 weeks, because I'm waiting for the blood vessels to grow in from your nose. And only then, and that piece of tissue that I need, whatever dimension it may be, or it might be both the skin and the mucosa that I'm reconstructing, is having a chance for the new blood vessels to grow in from the nose itself. And that blood vessel that came out of your orbit that goes up to your scalp is actually keeping that tissue alive during that time. So as drastic as this forehead flap technique sounds, I reassure patients that this bridge of tissue is the only purpose that it serves is that it keeps that template of tissue that's lost that I'm replacing. And after that, that tissue is taken away. And fortunately, my forehead flap patients over a period of time after they've had a chance to heal and for the scar to improve, that of course, if you look closely, of course there's scars, but that tissue is taken away, and the idea is that you do look normal, and that reconstruction from the tissue used from the forehead on the nose is so good that often, fortunately, the comments that a lot of my patients get is that they didn't know that they had such a dramatic surgery. I caught up with a patient of mine who had this technique and obviously had bigger than anticipated defect, and she was catching up with a friend one day, just having coffee, and she told me that in the midst of a conversation, they just both of them, her and her good friend, had forgotten that she had the surgery. Which was really good to hear, because that is what I'm here to do, and to put this experience behind them and really get on with their lives.